My name is Pieter Hooimeijer. I'm Professor of Human Geography and Demography at Utrecht University and Principal Investigator of a larger program on the relation between population and poverty in Rwanda. This is the starting point of the research. Turning Vision 2020 into reality is a program by the Rwandese government to shift away from deep poverty into sustainable human development. There is a vicious cycle of extreme poverty, which leads to high population growth. High population growth leads to extreme poverty. And the idea was, could we break this vicious cycle by extra foreign direct investment? Well, this is a good idea, but it takes a long time. Could we break that vicious cycle also in a different way by analyzing whether it's possible to reduce population growth in the short run, which would mean that it might have positive effects in terms of poverty at the individual level, which at the level of the country would actually mean that economic development would be stimulated. The dominant hypothesis is that if you would have less children, that could actually have positive outcomes on a number of different domains within the households. It's about the health of the children. It's about their nutritional status, it's about the health of the mother, it's about the educational achievement of the children, etc., etc. So that's what we set off to do and see whether introducing family planning programs could have a beneficial effect. One of the issues in our project is, to what extent do women want to limit their fertility? It turns out that a lot of women actually did want to use modern contraception. The point is, it was not available. Only 10% of the women in 2005 had access to modern contraceptive services. So the recommendation from that article, which we published in 2009, was that if you would provide the services, it would actually mean that fertility rates would go down very, very quickly. That's the desire, yes? But could that be endogenous? So one of the projects, which is being carried out by Ignace Habimana, and he's looking specifically at the effect, what is the effect of infant death on the desire to replace the infant. Okay, that's the other variable which you already included.
Yeah. The main finding is infant mortality plays a key role in the desire to replace. So women will tend to make more children and to leave a room for death, for the death. They say, okay, I have to make as many kids as I can to leave a window, a room, for those. Maybe 3 of them will die. I don't know, we never know. So this will keep the population growing because of these factors that we highlight here.
Investment in public reproductive health services is actually contributing to a better quality of life at the level of the household in terms of health, poverty and educational outcomes. The cynicism that exists in the world on population programs and family planning programs is mistakenly. I mean, there is something to say for very strict population programs that enable women to reduce the number of children and provide better outcomes for their families. Now, I think we are able to prove that this works. So that would, I think, support the Rwandan government in further pursuing this sort of policy. So that's important. The added value of this research is that providing this sort of knowledge could help Rwanda to move away from that devastating past into a better future.